It's the longest drive ever. It was only 15 minutes, but it felt like 3 days to get there. And I'm thinking the worst. And she says, he has to come today. And I prepared my mind to think to myself, well, this is it. I may not be a father after all.
We have all the toys in the world for this little guy, and he just wants to play with all his tubes.
Yes, you, chunk-a-lunk. Hey, Bubba. They first were trying to stabilize her so we could get back home. That didn't work, so then they tried to stabilize her to get her to a bigger hospital. Eventually, we ended up where she was going into emergency C-section to have Elias for severe preeclampsia.
About 12 o'clock in the morning, they came in, they said, he's coming today. We're about to do this. They handed me a gown, they handed me a hat and some things to put on my shoes. I ripped them, I did it all wrong, and it happened. And at 1:02 a.m., after sitting in the hallway, people come outside, gowns on, blood, and they look at me and they said, hey, you want to see your son? I just fell out. I was crying. I was amazed to see what I saw. And I saw this little person from the size, from my ring finger to my wrist. And he was a whopping 1 pound, 2.3 ounces. This is how I hugged my son every day, to the point where he still recognizes me from doing that. On cue, right there. I mean, so that's how we hugged Bud for like the first 3 months of his life. We had no idea what the journey would be, knowing it was going to be for a total of 272 days. One thing that's wonderful about Brenner is they have neonatal surgeons. People have to come from far and wide because this hospital is right here in Winston-Salem that can cater to those needs.
Brenner came down and actually flew her on a fixed-wing jet and Elias up to Brenner, and he proceeded to spend another 4.5 months in the Brenner NICU.
I mean, he had heart surgery and several stomach surgeries and lots of infections, whether it be his lungs or his bladder, or he even had a blood infection once that they thought could have even spread to his spine, and so they even did like a spinal tap at one point because they thought he could have ended up with meningitis with how sick he was.
I think the question that you go through in the NICU is this normal? Is this a normal situation? And the answer is there's no normal in the NICU.
To be honest, I didn't know anything about what a NICU experience was, let alone what goes on behind those doors.
It was truly a ward where it's
open space.
It's open space, and it's several babies and not as much privacy, and you take that and you get out of a comfort zone to another place, and it gives you some anxiety, it gives you some fear.
You can only have 2 people in the NICU at a time. So if Katie wanted to bring her mom, I had to step out. So I couldn't even be in there with my mother-in-law seeing my son, versus in the PICU, we could have 4 or 5 people in that room. So we could have real family time together. We could go in and see Elias and spend time hanging out with him with that intimate time. So you're not only affecting just the child or just the parents, but you're affecting the family. This traumatic event can become a celebration when you have the time together as a family. And the NICU, the way it is now, doesn't allow that.
Every baby who's born deserves a fighting chance to live, and it shouldn't be because of a lack of technology or a lack of an environment. Noah was born with a 5% chance to live, and he's right there. So the next 22-weeker who has a 5% chance to live, who will have a better environment to thrive in, it'll be even better. To know that neonatal intensive care is not a perfect science, but what they do every day is work miracles. Those doctors, those practitioners, the nurses, the surgeons, every day teaming up, huddling to do what they can that's naturally supposed to happen in the womb and do it outside.
It's amazing.
It's amazing.
I've never seen people care about somebody that they hardly know, and more than just care about him, they care about Elias, they cared about Katie and I. The doctors, the nurses, the respiratory therapists, all the way down to the cleaning crews, that they're true angels. If he was not here at Brenner, he would not be here right now. They flat out saved his life.